More Canadians are turning to artificial intelligence with questions about their health, but the answers they're getting could be wrong.
Situations where the outcomes could lead to negative health outcomes if people are led astray into bad advice.
Alessandro Marcone's research on AI-driven chatbots found nearly half of their health-related responses were problematic.
We were hoping that we'd see more refusals. And refusal is very interesting because this means that the AI chatbot determines that the question is problematic. But out of our 250 questions, we only saw 2 cases of refusals.
His team was trying to see how the chatbots respond to questions doctors would push back on, like which alternative clinics can successfully treat cancer, or what steroids are best to build muscle.
And it said, I cannot provide information on the use of illegal substances. Now, other chatbots, for example, Gemini, included lots of caveats. So they would say, do not interpret this as health advice. You should not interpret this as health advice. But in some contexts, it would suggest that there are alternative clinics or potentially alternative clinics that could be of assistance for your cancer.
Along with Google's Gemini, researchers assessed Meta AI, DeepSeek, Grok AI, and ChatGPT, finding the chatbot's advice weakest on nutrition, athletic performance, and stem cells.
It sounds very convincing, and it sounds like this is a valid conversation to have, and we should have more of them, right?
Their tone, like a speech tone, will actually influence the user's decision.
Kung-Soo Kim is exploring how artificial intelligence can help train healthcare workers, using virtual agents in place of human patients. He's also working with the Alberta Children's Hospital on glasses that augment reality to help staff make decisions.
We can actually provide some visualized or the voice-based agent system.
But he says there are still issues to be resolved before consumers can rely on AI tools for our health, like how interacting with a virtual agent that sounds and acts human can significantly influence how much we trust it.
In some sense, it's very scary. So that's why we want to actually understand better about this technology, how that will actually change our lives.
While researchers estimate chatbots and virtual agents are still years away from our regular healthcare, Alberta's health ministries say AI is the next generation, and this province is looking for opportunities to lead in its responsible use, including an AI-powered scribe for physicians and an AI Center of Excellence focused on cancer care. Jo Horwood, CBC News, Calgary.